Here at the PHN, we're really excited to be celebrating National Palliative Care Week by organising these two community awareness events, so one in Gosford and one in Tamworth, where we've attracted over 250 attendees across both events. We've got a range of trade store holders as well as speakers from all different parts of the palliative care sector, and we're just really excited about the level of engagement that we've gotten from the community. As part of the work at the PHN, we did a palliative care needs assessment of our region, and it was identified from that death literacy in the community plays a big role on people's experiences of care, so both for patients of palliative care and their carers and support people as well. So these events really try and highlight and tackle that need. As we know, with more education, the more informed you are to make decisions, and really we want people to feel more empowered and have choice during their end-of-life journey.
We're trying to increase awareness of services that are available to people who require palliative care. It's part of the strategic direction that the Primary Health Network have, which is about promoting services that are increasing equity of access to primary health care. And sometimes people can think there's not a lot of services for this particular need they have, but often it's just that they can't find them. So it's events like this that help the community find the services that are here for them.
I really think we are at the cutting edge of a whole new approach to death and dying. And we can see it with the death doulas here, the voluntary assisted dying navigators from the local health district. People who are providing more alternative funerals are here today. So it's great to see everybody here today sharing those new and more individualised approaches to death and dying.
I think it's really important to have an awareness event like this because it raises the profile and knowing who to talk to, knowing what services are actually available to them, whether it be in the hospital and whether it be at their home, and knowing that they actually can be at home for end-of-life care.
There are so many services and so much information out there, really good information and services, but often people really don't know where to start or where to find that information. So bringing it all together in one place for people, giving them the opportunity to take some information away, to ask their questions individually, I think it's a great thing.
I have been one of those family members that have felt a little bit isolated and a bit siloed and not really knowing who to ask, where to go to. It's awesome that so many people are coming together to try and improve the awareness, because it's taken a long time to get this type of event happening in this space.
The opportunity to be able to bring together a lot of the richness that's actually already happening in the community but happening in silos. So the ability that the PHN has to actually gather and connect the networks of amazing services that are happening out in the community in the Central Coast and beyond. And when we come together, we're more aware of one another, and then we're more able to refer on to those other services, therefore providing a greater support network for those who are walking that palliative journey, be it the person themselves or their circle of support.
Getting to link up and complement with all the services here today. I'm forever meeting another service that supports obviously our community at home, so it's been great to work together and obviously educate the community that's out there.
For the Primary Health Network to have this running, it's just a great initiative for other providers to get together and other palliative care teams to kind of cross over and talk about areas that maybe we don't know about, we're not aware of, understanding better services and what's available to access for both providers and for patients and residents. It's a really good incentive, and I recommend anybody to come along to it who's in a healthcare profession or an aged care company or home care to come and understand palliative care, because it's there and it needs to be discussed.
The PHN is supporting healthy people, healthy communities, and that's really what we want to do today. So it's both improving education but also having those resources and that information to take away to then apply to their personal situation.